So good evening, ladies and gentlemen. Thank you for joining us tonight. Welcome to the fourth Bracco UK webinar on contrast echocardiography. I'd like to warmly thank the whole team at Bracco UK for continuously supporting education in echocardiography and for giving us this new opportunity tonight to learn together. I must inform you that tonight's webinar will be recorded and that it will be published on our educational web platform in the upcoming days. For interacting with the faculty tonight, please use the Q&A button at the bottom of your screen to ask your questions. Please feel free to do it at any time during the lectures. Your question will be addressed at the end of the lecture or later on during the dedicated Q&A session. Tonight's webinar will be introduced and moderated by Professor Attila Kardos. Professor Kardos is a consultant cardiologist in Milton Keynes University Hospital, where he is also the Associate Director of Research and the Director of the Cardiovascular Research Group. He has an honorary chair at the University of Buckingham as Professor of Cardiovascular Medicine and holds a visiting professional position at both Cranfield and Open universities. He has been an honorary senior lecturer to the Division of Cardiovascular Medicine at the Radcliffe Department of Medicine, University of Oxford. He is the director of the Multimodality Cardiovascular Imaging Service in Milton Keynes. Professor Kardos, you have the floor.
Thanks very much, Jerome, and it's my great pleasure again to welcome you all to the Bracco webinar 2024. We have tonight an exciting lineup with excellent faculty who are internationally recognized leaders in the field of echocardiography, in particular stress echocardiography. To start off our webinar, I'm going to share my screen if I can. To start our webinar, for those stress echo skeptics in the audience, I'm pleased to say that stress echocardiogram is here to stay. The ACC and AAJ 2021 chronic coronary syndrome guidelines and the recent ESC 2024 guidelines states that stress echocardiogram remains a main pillar of the diagnosis of ischemic heart disease in patients with chest pain or effort breathlessness with moderate and high pretest probability. The reason of this increased confidence in stress echo in the guidelines can be attributed to three factors that have contributed to the advancement of ultrasonography. The advancement in transducer technology, the advancement in software technology, and the implementation of the use of ultrasonic contrast agents. They have led to advanced endocardial border detection, assessing the left ventricle volumes, ejection fraction, wall motion scores, myocardial perfusion, and coronary flow velocity reserve. This in turn improved accuracy in detection inducible ischemia either by occlusive epicardial coronary artery disease or non-occlusive coronary artery disease in patients with angina. The prediction of short-term and long-term outcome has also been documented. The ESC 2024 guidelines do recommend at a class 1B level ultrasound contrast agent usage during stress echocardiogram in patients in whom two or more neighboring myocardial segments are not visualized. This helps to improve diagnostic accuracy and, of course, also prognosis. The guidelines also give 1B recommendations for stress echocardiogram to do myocardial perfusion with ultrasound contrast enhancement agents to improve diagnostic accuracy and to refine risk stratification beyond wall motions. There's 2B indication at level of evidence B to assess LAD, distal left anterior descending artery coronary flow with Doppler ultrasound during stress echocardiogram, and the contrast enhanced agents can help to visualize the LAD flow, as you can see on these images, to improve risk stratification beyond wall motion abnormality, and more importantly, to assess microvascular function. We do know that stress echocardiography has got excellent short-term prognostic value, both negative and positive. And we also know that not just short, but long-term prognosis of either positive or negative stress echocardiography is remarkable. AI is used now in stress echo research extensively, and we have been learned from this paper and many more to come from Paul about how adding left ventricle systolic function to wall motion abnormality can enhance the diagnostic accuracy of stress echocardiogram. So without further ado, we are going to, this webinar tonight is going to help us in gaining insights into the quality improvement by ultrasonic implementation of ultrasonic contrast agent in detecting left ventricle endocardial border to assess wall thickenings and systolic thickening, and to be able to accurately assess left ventricle wall motions. We will learn about the future possibilities in employing augmented imaging in interpreting stress images. We will be educated how to troubleshoot and apply ultrasonic contrast agent in a daily echographic practice. And we will learn about the safety of ultrasonic contrast agent in the critical care settings.